An eating disorder is a really serious mental illness that impacts the way that a person might think and feel and impact on their eating behaviour, and it can really get to a point where it takes over somebody's life and can make them really poorly, really unwell. Sometimes it can involve eating too much or not enough and have lots of worries and thoughts around body image, shape, size and self-esteem. There are lots of different types of eating disorders. Eating disorder is a big kind of umbrella word, and there's lots of specific ones that are underneath that, and lots of people have maybe heard of anorexia nervosa and bulimia nervosa and maybe even binge eating disorder. I think what's really important to remember is that they're all really serious, and it's important to get expert medical help to make sure that you get the correct diagnosis and then the most appropriate and helpful treatment. So whether somebody is eating too much or too little, that can have a real impact on somebody's physical health. So although an eating disorder is very much a mental health difficulty, it can really impact on someone's physical health. And we know that the quicker that somebody is assessed and diagnosed and accessing and engaging in treatment, the better the outcome for that person. Some of the statistics around eating disorders are really shocking, a little bit scary, and we know that on average about 50% of people with an eating disorder make a full recovery, about 30% make a significant improvement in their symptoms and their difficulties, and sadly about 20% of people with an eating disorder will remain chronically really poorly. While some of those statistics can seem quite scary, it's really important to know that there are lots of things that can help, there's lots of people and services available to help, and that recovery, full recovery from an eating disorder is absolutely possible and achievable. It's important to say that lots of young people have worries about their appearance and their weight and their shape from time to time, but people with an eating disorder, it can really impact on all aspects of their life. It can impact on their physical health, their education, their relationships with friends and family, and even just daily living, so engaging in activities and interests, things that they used to enjoy. So some of the signs and symptoms that you might see in somebody with an eating difficulty is a lot of worry about eating, worry about how much to eat, what to eat, when to eat, and changes in your normal eating patterns, changes in what you would usually eat, and also maybe how you see yourself, the amount that you're thinking about it, worrying about it. And often people that do really drastically change how much they eat might start feeling physically quite unwell. They might get a lot of headaches, they might feel quite sick, quite dizzy, they may not feel like they've got much energy or that it's hard to concentrate. And also family members and friends might notice, or even teachers or people at college might notice the changes in how you are, how happy you are, how able you are to concentrate on your work at school. So there's lots of different things that can add up to a picture that something is going on and maybe you need to get some help. It's really important that you don't diagnose yourself, but that you go and get some medical help. And it's also important to remember that if you're reading these lists and you're seeing some of these symptoms and you're feeling a little bit worried, that you're not alone. Lots of people experience those difficulties, and it doesn't always mean that you've got an eating disorder, but it's really important that you go and get those things checked if you've got any worries or concerns. In our experience, there's no one cause of why somebody might develop an eating difficulty. Feelings of sadness, of worry, and feelings of stress. There can be certain life events that might add to that stress. Things like exams or bullying, friendship difficulties, relationship and family difficulties, bereavement and loss. So sometimes those are factors that might influence how somebody might cope. And then there are personal factors as well, so things like having low self-esteem or depression, anxiety. But it's important to say that if you identify with one of those things, that doesn't necessarily mean that you will develop an eating disorder. It's just that we know that some things can impact on how people cope and their resilience. If you are worried about yourself, or maybe a friend, somebody that you care about, and you're worried whether they may have an eating difficulty or not, the first thing to do is to tell a parent or carer or a trusted adult and share that information. There's absolutely no shame at all in admitting that maybe you've got a problem, because often that way you can then begin to access the help and support that you might need to get back to doing all the things that are really important for you, like school and friends and hobbies and interests. One of the things we'd really recommend is going to see your GP. So we've talked a little bit about how important it is because of the physical health and the medical complications associated with eating disorders, as well as accessing a specialist eating disorder service for information, advice, or to be able to discuss whether or not having an assessment and getting some treatment from our team would be the most helpful thing to do.